Hello everyone, I'm Dr. Rohan Khandelwal. I'm the Principal Consultant at the Breast Center at Birla Hospital in Gurgaon. Today I'm here to tell you briefly about a breast self-examination which can help you in detecting lumps at an early stage. To help me with the demonstration is Ms. Supinder. She is our best chemo nurse and she takes care of all our breast cancer patients at Birla Hospital. Breast cancer, as you know, is the most common cancer amongst Indian women. So one of the ways how we can pick up breast lumps early is breast self-examination. Now this term itself has undergone a lot of change over the years. Earlier they used to recommend that a lady should do an examination every month. But now the new terminology is that a lady should be breast aware. They should know what the breasts feel like and they should be able to make out if there's been any recent change or not. Okay. Now you don't need to be rigid that you do it every month, but that is how people like to remember it. So even if you're doing it every month, it's good. If you forget a month, but don't forget to do it, say, for 4, 5, 6 months. Keep on doing it regularly. That's what we want to push across. Now, if you're still getting your periods, then this should be done after you've had your periods. So say on the 5th or the 6th day of your cycles, that's when you should do the scan. Because if you do it before the periods, the breast is swollen, it is tender, and you might not be able to pick up a lump. You can miss small lumps as well. If your periods have already stopped, then you can choose any day in the calendar and you can do it repeatedly on that day itself. Now, ideally what we recommend is that you should do it when you're in the shower and you should apply some soap on your hand because that helps in picking up smaller lumps as well. And you need to keep your hand on your head like this, the way Ms. Supinder is demonstrating. And it is now very important that you're going to feel with the pulp of 3 fingers, right? Not the tip, please, the pulp of 3 fingers. And you make a circular motion and feel all over your breast. And best is to follow a clockwise motion so that you don't miss out on any area. In the end, you should feel behind the nipple and the areola as well to see for any lumps there. Okay. Now, one thing which I want to highlight, a very common mistake with which ladies come to me in the clinic is that they tend to hold the breast like this. Okay. They tend to hold the breast tissue like this. And if you do that, you'll always feel a lump. So don't make that mistake. As Ms. Supinder has demonstrated, we need to feel it with the pulp of 3 fingers in a circular motion. So this is how we do a breast examination, and we've shared some tips with you. I also want to highlight that doing a breast self-examination is good, but once a year after 35, you should visit a doctor as well. Because by doing a breast examination, you can detect lumps which are around 2 to 3 centimeters in size. But a trained physician can pick up lumps which are less than a centimeter in size as well. Also, after 40, don't forget to get a mammogram done. In the end, I would just like to say that it is best to be breast aware because breast cancer doesn't see whether you're a common man or you're a celebrity. It can affect anyone. And awareness and early detection is the only thing which can help in picking up cancer at an early age. And if it is done in that age, then you can even avoid the dreaded chemotherapy associated with breast cancer. Thank you for watching this video. And for more updates, keep on watching TOI Health and Fitness.